Hi, in this video, I will be explaining about kitchen task assessment. The kitchen task assessment tests the cognitively impaired person's ability to complete the task of making cooked pudding from a commercial package. The focus of the study is the cognitive and executive functional aspect rather than the sensory motor or the psychosocial aspect of the performance. The developer for this assessment is Corinne Baum and Dorothy Farah Edwards. The purpose for this assessment is to assess the cognitive ability of the patient to complete the task of making cooked pudding from a commercial package. Second, record the level of cognitive support needed for successful task completion. Third, evaluate the cognitive processes that affect task performance. Fourth, allow clinicians to observe and translate the patient performance into strategies the caregiver may use to manage the cognitively impaired person. Fifth, generate a score to measure changes in performance over time. This assessment is a performance-based assessment. There are 6 components that are being assessed in this assessment. The first one is initiation. Did they begin their task when asked to begin? Second, organization. Did they gather the necessary item, tools, ingredients, etc. to do the job? Third, performance of all tasks. Did they do everything that was necessary to complete the task? Fourth, sequencing. Did they do everything in order that made sense given the task? 5. Judgment and safety. Did they save and aware of potential danger? 5th, completion. Did they recognize the task was finished? Target population for this assessment is psychiatric patient, dementia, and Alzheimer. Contraindication is if the person does not have the ability to respond to verbal or physical assistance or both when asked to wash hands. The administration time of this assessment is 15 minutes. Administration procedure. For the pre-test setup, we need to place an item that we need on the counter. Next, print the instruction and put it where the patient can see it. Before beginning the assessment, clinicians must determine the individual ability to respond to verbal or physical assistance or both by instructing client to wash their hands. If the person cannot do this either with or without assistance, the task should not be administered, as the person will not able to follow cues and will be unsuccessful.
Puan sihat? Alhamdulillah. Okey, hari ni kita nak buat aktiviti. Aktiviti kita hari ni memasak, okey? So saya nak Puan masak puding. Alright. So saya dah sediakan semua bahan yang Puan perlukan. Yang ni langkah-langkah untuk masak puding. Dan yang ni ialah apron. Okey, Puan boleh guna. Jadi sebelum sebelum kita start, saya nak Puan basuh tangan dulu dengan sabun dan lap tangan Puan, okey? Lap tangan, okey. Puan dah basuh tangan, jadi Puan boleh mulalah. Start dengan langkah 1, okey? Kalau Puan nak pakai apron, Puan boleh pakai. Ni ada 2 flavor. Puan boleh pilih mana flavor Puan yang nak. Pilih yang nak pakai. Okey. Cawan yang ni yang paling besar sekali. Jadi Puan letak 2 cawan susu. Ya, betul. Betul.
Okay, okay.
Poin dua. Letak atas dapur. Tu baru start api. High sikit. Okay. Ambil yang spatula yang getah ni. Yang okay. Kacau. Sampai mendidih. Saya dah start mendidih. Puan boleh buka api dulu. Okay, dan dulu angkat tak dalam bekas ni. Okay. Okay, itu saja. Okay, itu saja video kami. Terima kasih Puan.
Sama-sama.
For scoring, we need to add all of the items. From the demonstration, the client scored 9 out of 24. The test result allows clinicians to observe and translate client performance into strategies that caregiver may use to manage cognitively impaired on ADL and IDL. The total scores range from 1 to 24. The higher the score shows, the patient required physical assistance or was not capable. Next, we will look into psychometric properties. For reliability, the first one is internal consistency. The Crumpet alpha for standardized variable was 0.961. The coefficient alpha of the kitchen test assessment to clinician dementia rating group was 0.873. In conclusion, KTA has good internal consistency. For the test retest, Pearson correlation coefficient among test items all exceeds 0.72. The cognitive domain selected for the KTA all contribute to the total score. Last one, iterator. Iterator reliability for the total score is 0.853. Next is validity. The first one is content validity. Can TA correlate with 5 valid and reliable neuroscience tests including the CDR or were significantly correlated. Next is discriminant. KTA was able to discriminate between different stages of Alzheimer's disease client. The meal preparation tool demonstrates changes over time by 77 CVA clients. Advantages of KTA assessment. It has good validity and reliability. It gives an objective measure that can be used to record changes in performance. They are helpful in obtaining objective information that occupational therapy can use in training caregivers to assist the patient. It also can be done in an individual home or in a clinic setting. And lastly, can be used with other meals, as the item on this assessment does not relate to meals. Next is disadvantage of this assessment. This assessment lack of studies and does not have any new or latest study. Many neuropsych testing generally does not reveal the patient difficulty with real-life activity, and it has no standardized norm and no interpretation of scoring. This assessment is suitable to use in Malaysia because it is easy to do and it does not relate to any beliefs and value, as we know that Malaysia is a diverse country. That's all from me. Thank you and have a good day.